Good afternoon. Thank you for joining the Justice and Mental Health Collaboration Program 2017 Grant Application Assistance Webinar. The Justice and Mental Health Collaboration Program, or JMHCP, is a very important initiative to help reduce the prevalence of individuals with mental illness and co-occurring substance use disorders that are in our criminal justice system, and to promote further collaboration between organizations in both the criminal justice and mental health system. For this webinar, we're going to start with some welcome and introduction, then we'll move into an overview of the Justice and Mental Health Collaboration Program, followed by drilling down into the specifics of the Justice and Mental Health Collaboration grant categories. Of note is that 2 of the grant categories for this year have been slightly changed, so please pay attention for Category 2 and Category 3 changes. Then at the end, we will follow up with questions and answers. So if you have any questions, you can refer to the chat box on your right and feel free to type them in at any time. We'll aggregate those questions and then ask them at the questions and answer sessions at the end of the webinar. Today we have 3 speakers on the webinar. We have Richard Cho, Director of Behavioral Health at the Council of State Governments Justice Center, Maria Fryer, Justice Systems and Corrections Policy Advisor for Substance Abuse and Mental Health from the Bureau of Justice Assistance at the United States Department of Justice. And we also have me, Sarah Wurzberg. I'm a Grantee Technical Assistance Manager for Behavioral Health at the Council of State Governments Justice Center.
Great. My name is Richard Cho, and I'm the Director of Behavioral Health at the Council of State Governments Justice Center, as Sarah mentioned. I really just want to take a few moments on today's webinar to formally introduce the CSG Justice Center and tell you a little bit about the work that we do, in particular the work of the Behavioral Health Division. The Council of State Governments, or CSG, is a national nonprofit membership association that represents state policymakers from all 3 branches of government. The Justice Center, which is a part of CSG, provides practical data-driven guidance and advisement on criminal justice policies and practices at the federal, state, and local levels. We do a number of things in that capacity, including working with states on an effort known as Justice Reinvestment, where we advise states on how to use a data-driven approach to improve public safety, reduce corrections and related criminal justice spending, and reinvest savings in strategies that can decrease crime and reduce recidivism. We also serve as the federally funded provider of training and technical assistance under the Department of Justice's grant programs, including the Second Chance Act, as well as the program we're talking about today, the Justice and Mental Health Collaboration Program. The division that I have the honor and pleasure of leading, the Behavioral Health Division here at the CSG Justice Center, focuses specifically on how to improve outcomes for people with behavioral health issues and disorders who come into contact with the criminal justice system. Broadly stated, our focus is on 2 things. First, we're working with states and counties to implement policy reforms and practices and programs that can help reverse the overrepresentation of people with behavioral health disorders who are involved in the criminal justice system, and to stop using jails as our de facto mental health system. Second, because we also know that criminal justice involvement is inevitable for some people with behavioral health needs, we also want to ensure that both law enforcement agencies as well as criminal justice agencies working in partnership with their behavioral health partners have the capacity to appropriately respond to people with behavioral health needs to reduce their harm, improve their outcomes, and increase public safety. We're one of the leading partners of the Stepping Up initiative, which you'll hear about, a national initiative to reduce the number of people with mental illnesses in jails, in which more than 320 counties across the country, representing 42 states and over 1/3 of the U.S. population, have publicly committed to stop using jails as their de facto mental health system. We also work to develop tools and resources that help improve the capacity of law enforcement to appropriately respond to people with behavioral health needs. For example, in the fall of 2016, the Bureau of Justice Assistance released the Police Mental Health Collaboration Toolkit, which we helped to develop. We're pleased to be continuing our role as the provider of training and TA for JMHCP grantees, including for the FY17 solicitation. I'm particularly excited about the new emphases that BJ has placed this year on the need for front-end and early diversion programs, as well as systems-level changes and enhancements both for law enforcement agencies as well as for county-level collaborations between criminal justice and behavioral health. There's no greater time, I think, for communities to bring to scale those solutions and innovations that we know are effective in tackling the growing crisis involving people with mental illnesses and co-occurring substance use disorders who come into contact with law enforcement in the criminal justice system. So with that, I'm going to turn things back to Sarah.
Thank you, Richard. The Justice and Mental Health Collaboration Program funding has had a long history of bipartisan support beginning in 2004. Most recently, in December 2016, the 21st Century Cures Act, a milestone bill to address mental illness and substance use disorders in criminal justice systems, provided funding for JMHCP. JMHCP supports innovative cross-systems collaboration to improve responses and outcomes for individuals with mental illness or co-occurring mental illness and substance use disorders who come into contact with the justice system. BJA is seeking applicants that demonstrate a collaborative project between criminal justice and mental health partners from eligible applicants to plan and implement justice and mental health strategies collectively designed with the justice and mental health partners. $92.4 million has been awarded in the past decade for the JMHCP program, between 23 and 62 awards per year. There have been several different focuses for different grantees through JMHCP over the past decade, from courts and corrections to co-occurring disorders to law enforcement and collaborative county approaches. The focus this year, as Maria will discuss, is diversion options for people with mental illness and co-occurring substance use disorder and system plannings for counties and law enforcement agencies. Overall, there have been 379 awards representing 47 states and 2 territories. I will now turn it over to Maria Fryer from the Bureau of Justice Assistance to provide the overview of the JMHCP grant program and the grant categories.
Bureau of Justice Assistance is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and strategies to achieve safer communities. Now we will conduct an overview of JMHCP. As Richard mentioned, there's a new focus on diversion and planning. This program seeks to increase the number of justice, mental health, and community partnerships, increase evidence-based practices and treatment responses to people with behavioral health disorders in the justice system, and increase the collection of health and justice data to accurately respond to the prevalence of justice-involved people with mental health and co-occurring substance use disorders. It also seeks for planning for system-level change, including new microgrants for law enforcement agencies. Although law enforcement has been a focus and a part of JMHCP for some time, and were provided priority consideration in fiscal years 14, 15, and 16. In 2016, it brought a number of national initiatives together, working to assist jurisdictions that are committed to improving their justice system responses to people with mental illness and co-occurring substance use disorders. Such initiatives include the One Mind campaign through the International Association of Chiefs of Police and BJA's Police Mental Health Collaboration Toolkit. This toolkit also complements the 2015 initiated Stepping Up program and initiative. As we move forward with these initiatives, BJA added Category 2 to be responsive to the field with resources and technical assistance to aid the designing of their new strategy. Next slide. There are no shortages of headlines. The new focus of the JMHCP program is to address the need for increasing early identification of people with mental health and co-occurring disorders who are making contact with the criminal justice system by placing a greater emphasis on ways to prevent further involvement. Next slide. As mentioned earlier, this national initiative, the Stepping Up Initiative, was launched in May of 2015 as a partnership between the Council of State Governments Justice Center, the National Association of Counties, and the American Psychiatric Association Foundation. The initiative has rallied more than 323 counties nationwide, representing nearly 35% of the U.S. population, to commit to actions toward reducing the number of people with mental illnesses in jails. At a recent summit, 26 counties were from California alone. During the summit, this past January, the 6 questions document was officially released. The document poses 6 key questions to community stakeholders so that they may answer those questions in order to put them on a path toward establishing a comprehensive strategy to impact the problem. The roadmap for local leaders addresses key elements of a successful plan, including the need for screening and assessment for mental illness upon admission to jail, establishing a baseline of data for counties to follow, tracking progress on key outcomes such as recidivism rates, and ensuring connections to treatment. Again, BJA recognizes the need to support law enforcement with resources through the newly created Category 2 of the Justice and Mental Health Collaboration Program and Best and Promising Practices. Next slide. As noted by the goals and deliverables for fiscal year 2017, BJA has revised the goals of the JMHCP program to move away from facilitating small-scale programming, which meets the needs of a limited targeted population, and move towards support for systemic reviews and changes. This will allow state, local, and tribal justice systems to more comprehensively respond to people with mental illnesses and co-occurring substance use disorders. Next slide. Target population requirements. As programs are designed and eligibility criteria considered for program participation, evidence-based practices should be used, such as a validated risk and needs assessment, to determine eligibility. Next slide. As a result of the 21st Century Cures Act, there have been some changes made to the target population, or those who qualify for program participation. The third bullet is very specific. Also, please note, while co-occurring mental and substance use disorders are common in this population, applicants should not work with a substance use population only. JMHCP funds are intended for use with a population with mental disorders only or co-occurring mental and substance use disorders. Applicants must justify in the proposal the reasons for selecting their identified target population and should provide data on the needs of the target population to support this selection. In addition, applicants must specify the total number of individuals the project expects to serve during the grant period and provide evidence demonstrating this figure is achievable. Next slide. For court-based programs, in addition to the requirements listed previously, in determining a defendant's eligibility for participation in a program funded under this solicitation, the relevant prosecuting attorney, defense attorney, probation or corrections official, judge, and mental health or substance abuse agency representative shall take into account the following considerations: whether the participation of the defendant in the program would pose a substantial risk of violence in the community, the criminal history of the defendant, and the nature of the severity of the offense for which the defendant is charged, the views of any relevant victims to the offense, the extent to which the defendant would benefit from participation in the program, the extent to which the community would realize cost savings because of the defendant's participation in the program, whether the defendant satisfies the eligibility criteria for the program participation unanimously established by the relevant prosecuting attorney, defense attorney, probation or corrections official, judge, and mental health or substance abuse agency representative. All programs should have clear and transparent eligibility requirements and accept any individual who meets those requirements after they have been screened for criminogenic risk and mental health needs. Next slide. Okay, JMHCP grant categories. Next slide. Category 1, collaborative county approaches to reducing the prevalence of individuals with mental disorders in jail. The grant amount is up to $200,000 and the project period is for 24 months. Category 2, strategic planning for law enforcement and mental health collaboration. Grant amount is up to $75,000 and the project period is for 12 months. And Category 3, implementation and expansion. Grant amount is up to $300,000 and the project period is for 24 months. Next slide. Category 1 supports collaborative planning process with county leadership toward the goal of reducing the number of individuals with mental disorders and co-occurring substance use disorders in local jails who can be safely supervised and or treated in the community. Category 1 grantees will demonstrate a commitment to system-level reduction in the prevalence of mental illness in jails. Beyond intercept-specific programs, diversion, mental health court, correction programs, reentry programs, etc., counties will work toward a coordinated response to maximize diversion for individuals with mental disorders. That includes a county system analysis to identify strategies to reduce the prevalence of individuals with mental disorders in local jails, screening and assessing all people with potential mental disorders booked into jail for criminogenic risk and needs, recording this information in an electronic record, ensuring this information is shared appropriately to inform pretrial decision-making, and defining mental health needs in terms that align with state definitions that pertain to eligibility for publicly funded mental health services. Next slide. Category 1 priorities. Grantees must work with BJA's training and technical assistance provider for JMHCP to CSG Justice Center to complete a planning and implementation guide as well as planning phase, and after completion of the planning phase, an implementation phase to help grantees complete the activities listed next. Next slide. The planning phase. In planning category 1, this includes such activities as team meetings, identifying an evaluator, analyzing data, analyzing system processes and policies. Next slide. Implementation phase. Moving from planning to operationalizing the program, administering tools, actually making program changes based on data, adjusting processes, and beginning to do the work that is set out in the goals and objectives. Next slide. The new category, planning for law enforcement. Demonstrate a commitment on the part of law enforcement, mental health agencies, and local government leaders by conducting a strategic planning process to select a law enforcement mental health collaboration strategy. For more information about police mental health collaboration options, visit the toolkit at www.bja.gov/PMHC. Next slide. Category 2, Agencies will be provided practical and actionable written guidance drawn from successful experiences of law enforcement to design their police mental health collaboration strategies. The main grant deliverable includes an action plan encompassing such elements as the commitment of leadership, collaboration with behavioral health agencies, written policies and procedures, necessary police and mental health resource allocation, training curricula and practices, including what % of the force is trained, how to select who receives training, training for call takers, dispatchers, etc., staffing and performance evaluations, and the use of data for performance and outcome measurement. Next slide. Category 2, use of funds. Allowable costs include personnel, consultants, evaluation, meeting costs, and travel. Law enforcement consultant services to assist can include the assessment and review of data related to calls for service, the assessment of written policies and procedures related to response, the assessment of current practices in information systems and communications, the review of agency training curricula, delivery, and peer support. Next slide. Category 3, implementation and expansion. Any of the following examples of allowable uses of grant funds may be combined with one another, or may be combined with an evaluation component, which would receive priority consideration. And we're going to discuss priority consideration a little further in the grant presentation. Grantees will receive technical assistance through written guidance and review of their implementation expansion strategy. They will be required to complete and submit a planning and implementation guide to be provided by BJA, the TTA provider for BJA, CSG, that reflects the program being implemented. Next slide. Planning and implementation guide. Completion and submission of the planning and implementation guide. Grantees will receive intensive technical assistance and will be allowed to access up to $100,000 of the total grant award in order to complete and submit a required planning and implementation guide provided by the BJA TTA provider CSG, which will guide each grantee in developing a strategic plan that incorporates evidence-based programs, policies, and practices. Program budget approval in coordination with a technical assistance coordinator is required to complete and submit a planning and implementation guide. Law enforcement agencies that apply under Category 3 must demonstrate a track record of collaboration or partnership with community mental health agencies. Law enforcement applicants must demonstrate in the narrative a written action plan describing areas needing improvement or enhancement based on a comprehensive review and assessment. An executed memorandum of understanding or other similar written agreement between law enforcement agency and one or more behavioral health partners outlining the terms of their partnership and collaboration. A description of training curricula and in-service training regarding behavioral health. A letter or document indicating the commitment of leadership from law enforcement agencies or other local officials to carry out the plan. The availability of data and capacity to measure. Next slide. Category 3, allowable uses. Training for criminal justice, mental health, and substance use treatment personnel, enhancing access to community-based healthcare services and coverage, law enforcement responses, diversion and alternate sentencing, correctional facility grants, community supervision strategies, case management, and direct services. Next slide. References for applicants. Program evaluation, risk needs, responsibilities, principles, screening and assessment tools, providing interventions that address criminogenic needs, mental health, treatment services, housing, supported employment, and supported education. I'm going to say a little bit about each one of these because of their significance in this program. Program evaluation is critical to the effectiveness and utility of the JMHCP programs, as evaluation not only determines which programs are most effective for which populations, but also contributes towards the expansion of knowledge of what programs have the highest likelihood for success in lowering recidivism and improving public health outcomes. BJA strongly urges applicants to consider a partnership with a local research organization that can assist with data collection, performance measurement, and local evaluation. One resource that applicants may be interested in using is the E-Consortium for University Centers and Researchers for Partnerships with Justice Practitioners. The purpose of this E-Consortium is to provide a resource to local, state, federal, and other groups who seek to connect to nearby university researchers and centers on partnerships and projects that are mutually beneficial to the criminal justice community. The E-Consortium can be found online at www.gmuconsortium.org. Risk Needs Responsivity Principle. Current research supports the R&R model for how criminal justice authorities should be identifying and prioritizing individuals to receive appropriate interventions. BJA intends to fund programs that have a demonstrated evidence base and that are appropriate for the target population. Applicants should incorporate the following evidence-based practices in the development or enhancement of their client-based programs. 1, screening and assessment tools. Screening and assessment of co-occurring disorders in the justice system provides an overview of screening and assessment of persons with co-occurring disorders involved in the criminal justice system and includes an extensive list of screening and assessment instruments for different target populations. Some examples of publications that could be helpful are found on the Council of State Government's Justice Center website, and the titles are Adults with Behavioral and Needs Under Correctional Supervision, a Shared Framework for Reducing Recidivism and Promoting Recovery. Another publication is Mental Health Screening Within Juvenile Justice, The Next Frontier, and this provides an overview of new issues and offers policy clarification on mental health screening in the juvenile justice system. Some good guidance that comes from the behavioral health community is that we should provide mental health treatment practices that have a demonstrated evidence base and that are appropriate for the target population. The following evidence-based mental health treatment practices have been shown to improve clinical outcomes for people with serious mental illness. Assertive community treatment, illness management and recovery, integrated mental health and substance abuse services, supported employment, psychopharmacology. Some other promising practices include Forensic Act, known as FACT, cognitive behavioral therapy. And applicants can also find information on evidence-based practices in SAMHSA, or Substance Abuse and Mental Health Services Administration's Guide to Evidence-Based Practices, available at www.samhsa.gov. Next slide. Priority considerations. For Category 1, priority consideration will be given to large urban counties or rural counties in partnership with neighboring counties or states. Also for Category 1, counties with a demonstrated commitment to reducing the prevalence of people with mental illness in jail. Priority consideration will also be given to those programs that incorporate program evaluation. For those programs that incorporate provision of services for justice system involved females, and for those that incorporate information sharing between criminal justice agencies and community behavioral health services. Next slide. Per the 21st Century Cures Act, grant funds must be used to support a target population that includes adults or juveniles that have been diagnosed or having a mental illness or co-occurring mental health and substance abuse disorder and have faced, are facing, or could face criminal charges for misdemeanor or felony that is a nonviolent offense. Next slide. On budget. An applicant should demonstrate in its budget narrative how it will maximize cost effectiveness of award expenditures. Budget narratives should generally describe cost effectiveness in relation to potential alternatives and the goals of the project. For example, a budget narrative should detail why planned in-person meetings are necessary, or how technology and collaboration with outside organizations should be used to reduce costs without compromising quality. The budget narrative should be mathematically sound and correspond clearly with the information and figures provided in the budget detail worksheet. The narrative should explain how the applicant estimated and calculated all costs and how those costs are necessary to the completion of the proposed project. The narrative may include tables for clarification, but need not be in a spreadsheet format. As with the budget detail worksheet, the budget narrative should describe costs by year. Applicants for categories 1 and 3 must explain their inability to fund the collaboration program adequately without federal assistance. Specify how federal support will be used to supplement, not supplant, state, local, Indian tribes, or tribal organization sources of funding that would otherwise be available, including billing third-party resources for services already covered, and outline plans for obtaining necessary support to continue the proposed collaboration program following federal support. With regards to unallowable uses, in addition to unallowable costs identified in the financial guide, award funds may not be used for prizes of rewards, entertainment, or trinkets, or any type of monetary incentive. It cannot be used for client stipends, gift cards, vehicles, food and beverage unless prior approval is obtained from the program's office. And there are some specific guidelines around food and beverage. For questions pertaining to budget and examples of allowable and unallowable costs, see the DOJ Grant Financial Guide. Cost sharing or match requirement. Cash or in-kind match contributions are allowable. Federal funds awarded under this program may not cover more than 80% of the total cost of the project being funded. An applicant must identify the source of 20% non-federal portion of the total project cost and how it will be used in the program. If a successful applicant's proposed match exceeds the required match amount and OJP approves the budget, the total match amount incorporated into the approved budget becomes mandatory and subject to audit. Funds may be used only for purposes that would be allowable for the federal funds. Recipients may satisfy this match requirement with either cash or in-kind services. Again, please reference the DOJ Grant Financial Guide. Pre-agreement costs, also known as pre-award costs. Pre-agreement costs and pre-award costs incurred by the applicant prior to the start date of the period of performance or the award date of the federal award. OJP does not typically approve pre-agreement costs. An applicant must request and obtain prior approval of OJP from OJP for all such costs, and such costs incurred prior to the award are at the sole risk of the applicant. Prior approval for planning and reporting of conferences, meetings, and training costs. OJP strongly encourages every applicant that proposes to use award funds for any conference, meeting, or training-related activity or similar event where people are gathered and federal funds are expended to review carefully before submitting an application. The OJP and DOJ policy and guidance on approval planning and reporting of such events is again available in the financial guide. Next slide. So a little bit more on budget requirements. All applicants must include funding to support attendance to a grantee orientation meeting. Categories 1 and 2 must include additional travel costs to attend a BJA-sponsored strategic planning meeting. Plan for at least 3 staff to attend a 3-day meeting in Washington, D.C. Categories 1 and 3 applicants must set aside an adequate amount of funding to implement a data collection plan. Applicants should structure their budgets to accommodate only a percentage of funds being available during the planning stage, with the remainder to be released upon the approval of the Planning and Implementation Guide. Next slide. During the peer review process, the review criteria is assigned percentages. The statement of the problem and the description of the issue is rated at 20%. The project design and implementation, 40%. Capabilities and competencies, 20%. For collecting the data required for the solicitation's performance measures, 10%. Plan for measuring program success to inform plans for sustainment at 5%. The budget should be complete, cost-effective, and allowable. It should also be reasonable, allocable, and necessary for project activities. And it's on to you, Sarah.
Thank you, Maria. In addition to what Richard explained earlier in the webinar, I wanted to provide you with a little more information on the Council of State Government Justice Center's role as it pertains to the Justice and Mental Health Collaboration Program. While BJA is the funder and oversees the grants management, selection, awarding, and maintenance of the individual grants, they contract with outside agencies to provide deeper technical assistance and content expertise in areas these programs often need as they are planning and implementing their initiative. Like you, we have applied for a grant through BJA to provide training and technical assistance to JMHCP grantees. We are excited to have been selected as the technical assistance provider for this grant. But also we provide technical assistance through a different contract to Second Chance Act grantees. Combined between these two grant programs, we have worked with 370 JMHCP grant awards and over 700 SCA grant awards. Once applications are accepted by the Bureau of Justice Assistance and more awards have been made, we work with BJA to assign you a technical assistance coordinator. Your technical assistance coordinator will work with you over the course of your grant period and can do a number of things in order to help you. We have monthly calls with JMHCP grantees in order to assist in the planning and implementation of the grant efforts. This will include working with grantees to complete the planning and implementation guides for Category 1 and Category 3 of JMHCP. We provide peer-to-peer learning through calls, web-based opportunities, and in-person meetings. This includes connections to the Bureau of Justice Assistance law enforcement learning sites and the Bureau of Justice Assistance mental health and criminal justice learning sites, which are focused on mental health courts and diversion programs. We regularly have webinars with content relevant to mental illness, co-occurring substance use disorder, and criminal justice issues, as well as distribute information on webinars from other partner organizations that has relevant content to the grantees. We provide expert trainings to assist with strategic planning and to refine best practices for planning and implementation. We also do a lot of resource sharing of key documents, webinars, and trainings that come across from the field, as well as sharing resources developed by fellow past and current JMHCP grantees. We will be able to provide site visits to some of the grantees over the course of the grant program to provide training, planning assistance, and work through implementation challenges. We assist with data collection and research and evaluation partnerships, facilitating strategic planning sessions or meeting of criminal justice and behavioral health task force, training on what works to reduce recidivism, promote recovery, and improve outcomes for people with mental illness and co-occurring disorders within the justice system, help translate research into proposed policy and practice improvements, and support the development of implementation and sustainability plans. Grantee orientation and strategic planning meetings will be held for fiscal year 17 JMHCP grantees with content focused based on the needs of the cohort. Category 1 and 2 grantees will also have the strategic planning meetings that will be focused on planning for county and law enforcement agencies to address mental illness. As part of that initiative, counties are supported to follow some outlined steps to achieve the goals and track for outcomes, which includes a reduction in the number of people with mental illness booked into jail, a reduction in the length of time people with mental illnesses and co-occurring disorders stay in jail, an increase in connections to treatment, and a reduction in recidivism. Law enforcement agencies may focus on establishing a clearly defined and sustainable partnership with one or more community mental health organizations, developing and implementing a model policy addressing police responses to persons affected by mental illness, training and certifying sworn officers and selected non-sworn staff, such as dispatchers, in mental health first aid for public safety, providing crisis intervention team trainings to agency sworn officers and selected non-sworn staff, such as dispatchers. So now we're going to move on to questions and answers. If you have any questions, please feel free to type them in the chat box at the bottom right of your screen. We also have received a bunch of questions already, which we'll begin answering in the meantime. There were a bunch of different questions on who the qualified applicants are for the Justice and Mental Health Collaboration Program. So the qualified applicants are state, county, and local units of government, as well as Indian tribal nations or organizations. There was a question specifically related to the tribal qualification, and I would refer you to the JMHCP solicitation on page 33, which also outlines some pieces of the tribal authorizing resolution. There's also the ability for tribes to apply as a consortium of tribes if they have the right documentation. Another agency asked if courts were eligible applicants. So as long as if the court fits in that definition of state, local, Indian, tribal organizations, then they would be eligible to apply. Maria, do you have anything to add to that?
No, you're doing great.
Okay. Another person indicated that they are working on their Stepping Up initiative within their judicial court system. And they said they've been having difficulty capturing information on screening and assessment tools for mental health and criminogenic risk factors for recidivism reduction. So I would point them to a couple of sources for this. If you go to the CSG Justice Center's website, we actually have a lot of resources on this. And there is specifically a document on risk assessment instruments that were validated and implemented in correctional settings in the United States. So I definitely point to that as a resource. There's also a screening and assessment for co-occurring disorders in the criminal justice system that was actually developed by the SAMHSA's GAIN Center, also available on their website or our website. Also if you're part of the Stepping Up initiative, there's a bunch of resources on the Stepping Up website as well, which is stepuptogether.org. So I would encourage you to look those out. You can also, you'll have contact information at the end of the call. You can also feel free to email me, and I'm happy to provide links to those resources. Another individual was asking, will there be any carve-out money for rural or small population applicants? And I think what I would point to there is that one of the priority considerations for Category 1 is rural counties in partnership with neighboring counties or states. Maria, do you have any other thing to add on the rural jurisdiction piece?
Oh, you were going the same place I was going, was the priority consideration for rural communities, to really talk about that in the narrative. Mm-hmm. But there is no carve-out. It's just, yes, the priority. So. Mm-hmm.
Okay, great. Another question was, is there a best place you would recommend looking for contact people within court systems at the state level? So I would point to a couple of different resources. One would be the National Center for State Courts. They have different lists of state coordinators in each of the states, and then as well as your state administrative office of the court, which typically has contact people. And then my colleague, Cynthia Kimmelman-DeVries, is going to add some additional information for us.
Yeah, we actually got a clarification on that question, which was really quite great. At the very beginning of the slide presentation, there was a national map of the number of JMHCP grants that were funded in your specific state. And the question was specific about that. How do I look up who the people are on that map? So who's been funded under JMHCP before? We have a really great reference for that, actually, which I just added to the middle chat box on the WebEx screen. It's on our website, csgjusticecenter.org, and it's under the reentry section, and it's the National Criminal Justice Initiatives map. It's really quite cool, actually. If you go to that map and you filter by the United States Department of Justice and the Bureau of Justice Assistance, when you click on BJA, you'll get a sub-filter for JMHCP, for the Residential Substance Abuse Treatment Program, the RSAT program, and for the Second Chance Act grantees. So you're able to sub-select or filter out by those things and see who else in your state has been funded, which is really super interesting. So I just put that in the chat box, and Sarah is more than happy to send that out to everybody afterwards if you've missed that, but it's on your screen.
Thank you so much, Cynthia, for that excellent information. So we've also had a couple of follow-up questions on specialty courts. One question was related to whether drug courts have the ability to apply or whether established mental health courts can apply. So just to answer that, an established program would be probably applying for the Category 3 determination, which is implementation and expansion. And as far as the drug court piece, the requirements for JMHCP is to address mental illness and co-occurring substance use disorders. So there would have to be a piece for mental illness there. Maria, is there any further clarification you'd like to provide for that piece?
No, just the emphasis on the fact that JMHCP is the only program that actually addresses mental illness in criminal justice system and co-occurring disorders. And so we have to usually emphasize that it is a unique program in that regard, that there must be a mental health component. It cannot fund activities that are just substance use focus.
And Sarah and Maria, this is Cynthia. I would just add that there have been many drug courts that have applied in the past, but just to echo what Sarah and Maria just said, it's fine for a drug court to apply as long as you are carving out, creating some sort of specialized list, but specific to treatment for people who have mental health or co-occurring disorders. So it's fine if you're a drug court, you don't have to be a mental health court, and you don't necessarily even have to be establishing a mental health court, but it is important that you are emphasizing the mental health piece, meaning screening and assessment and selecting clients that have a mental health or co-occurring disorder.
Thank you for that clarification. Another question we have is, when will the program funding be available? So the program... Yep, go ahead, Maria. Nope, go ahead.
Okay. I was just going to speak to the grant process, and typically what we do say is that if we follow the federal fiscal year, and that grantees, applicants will know by October 1st. That's typically when announcements go out. So it's a lengthy grant process.
Thank you, Maria. We also had another question about when will the RFP be posted and what is the due date for submission? So the RFP, or the solicitation, is actually already posted online. It is posted on the Bureau of Justice Systems Assistance website. So if you go to www.bja.gov/funding/JMHCP 2017.pdf, you can get that. The applications are due April 4th, 2017. You can also find information related to the solicitation on the CSG Justice Center website. Okay, so another question. Are there any restrictions for agencies that may be in close proximity to each other? For example, if the county my agency is located in applies, is my agency prohibited from applying?
The answer to that is no. You can still apply.
Great, thank you. There was another question about tribal entities. Can tribes apply for Category 1 without partnering with the county? Yes, they can. Tribal nations are eligible applicants and would be encouraged to apply. There's some questions about the co-occurring disorders piece on whether people have to be serving people with mental illness and a co-occurring substance use disorder, as well as if there are specific requirements to, if they're doing a co-occurring program, would they need to be required to use the ASAM criteria? So just to reiterate, the program can be either serving people with mental illness who are in the justice system, or people who have mental illness and a co-occurring substance use disorder. So you don't have to be serving a co-occurring population, but you can be serving a co-occurring population. And as far as the specific criteria question, that isn't a requirement. So Maria, this question might be for you. Can applicants submit to more than one category?
Yes, they can.
Thank you. Can this grant be leveraged against state funds or to enhance programs, or are funds only available to applicants with no other funding source?
I can answer that, Sarah. You can absolutely leverage against other funding sources, and matter of fact, that might be a strategy to use the federal funding only where the other funding for things that the other funding can't cover, and that might be a very good strategy, and it also might lay the foundation for sustainability as well.
Thank you so much, Marie, and I think that answered one of the other questions about matches and in-kind services as well. So we are looking at the time, and we're getting close to the end of the hour here. I want to make sure that we're able to show you some slides on follow-up contact information. Okay. So we actually do have time for additional questions. I apologize about that. Another follow-up question is, in terms of participant eligibility, are there accepted definitions for crimes of violence?
And that goes back to the slide where we emphasize that third bullet, which speaks to crimes against children and sex offenses. Mm-hmm.
Thank you, Maria. It says, there's also a question specifically related to Category 3. It says specialized training for justice. Is this meant only for law enforcement agencies? And for Category 3, the eligible applicants are actually beyond law enforcement agencies. It could be court-based agencies. It could be corrections agencies. So it could be multiple categories, but it also could be training for law enforcement agencies.
Mm-hmm.
Hey, Sarah, this is Cynthia. I'm going to help manage some of the questions for you. So some of these might be slightly redundant. I think they're kind of fast to answer. So an already established mental health court, can they apply for these funds?
They can. They would probably fit under the Category 3 funding.
Okay, great. Do current Category 1 grantees have to complete a P&I guide in order to apply for Category 3 funding?
That's a good question. So current Category 1 grantees are required to complete a P&I guide in order to meet the requirements of their grant. I think this jurisdiction is asking whether they would have to have that submitted prior to applying to this grant, which would mean prior to April. So I think the answer to that would be no, that would not be a requirement, but in order to meet the grant requirement, you would have to complete the guide and submit it prior to the end of your grant term. Is that correct, Maria?
Yes, that's correct.
And this is Cynthia. Maria, you might, I'm just going to jump in here and say that if you are applying for Category 3 funding while you already have an active Category 1 grant, your Category 3 grant would essentially need to be something different than what you're doing in Category 1. Because of the nature of the change in the solicitation this year, Category 1 grants are really more about planning and evaluating your system, and Category 3 is really about planning and implementing a specific discrete program.
I mean, I think we're almost done.
Next question, and the population of our county is almost 100,000. Are we considered rural or urban for this solicitation? We're located in rural West Tennessee. And I'll just jump in and say that because while there's a priority consideration for rural jurisdictions in general, what that means is not really necessary for this application. The need in your jurisdiction is blind regardless of whether or not it's rural, urban, suburban. So it's really not necessary to make that distinction specifically in this application.
Cynthia, I would add to that if the applicant would like to make that distinction and they feel like they could potentially come in under a priority consideration for rural, they could go to the census website, and they have some calculations and ways to calculate if you're rural or not.
Great. I think we have time for just a couple more questions. And Maria, I think we know the answer to this. I think it would be great for it to be coming from you, but will the change in administration potentially change availability of these initiatives? We don't know at this point. We still are under a continuing resolution. We're moving forward, and I wish I had a better answer there. So, yep. Okay. Give me one more second. Just trying to muddle through a couple more of so many questions that have come in. There were a couple of questions that were about matching. That might be good to answer. Is there a match required, and if so, does in-kind qualify, and can a match be soft in-kind services?
Yes. Match can be in-kind, which are those services which you would otherwise have to go out and pay for with the federal funding. And if a service or good can be provided and a calculation can be put into your budget in the line item where the donation of goods and services is coming from, whichever budget category, you would put it in there, and you have to match 20. So basically, the grant program is an 80-20 split. So 80% is federal and 20% is matched, and that creates your total budget.
Great. Just for everyone's reference, we're putting up the contact information for Sarah and Maria and everyone. So there are definitely going to be some questions that we're not going to get to today. We do encourage you to email either us at the Council of State Governments Justice Center, that would be Sarah, or Maria, to help answer some of these specific questions. I'm just going to ask a couple of very fast, small ones left. Maria, just wanted to confirm that this is open to juvenile court programs as well?
Yes.
Okay. And are universities a qualified applicant?
Okay, that may fall under the state eligibility criteria, because once again, it's state, local, or tribal. So if it's a state university, yes.
Great. This is a great question too. Are there any restrictions for agencies that may be in close proximity to one another? For example, if the county that my agency is located in applies, may my agency be prohibited from applying?
I'm sorry, if they're close to where?
So if the county is applying and then an agency within the county is applying, can they both still apply? It would, the agency within that county, they would have to be a county agency because, again, it's going to default to local government, who would be the applicant agency. But if that agency is within that county, is also a county agency, then yes, they can both apply. There could be multiple applications that come from any single county. Okay. I think that's about all that we have time for today. I'm going to turn it back to Sarah.
Thank you so much to everyone for participating in this webinar. We also have a few upcoming webinars that we'd like to highlight for additional information on the Justice and Mental Health Collaboration Program application process. On February 16th, in partnership with Bureau of Justice Assistance, we'll be hosting a JMeet budget and grants management webinar. So if you have specific questions about developing a budget for this grant, it would be a great place to log on and be able to ask those questions. We also are having a webinar specifically focused on law enforcement agencies. Since we have the new second category focused on law enforcement planning, we want to make sure to provide further information on that category as well as opportunities for those agencies. That webinar will be held on February 9th. Information on both of those webinars are available at the CSG Justice Center website, so feel free to come and visit us and you can have that information. This now concludes the Justice and Mental Health Collaboration Program 2017 Grant Application Assistance webinar. Thank you for your attendance and participation, and thank you to our presenters, Maria and Richard. We very much look forward to working with all of you. We will also be recording this and send it out to those people who registered for the webinar, and it will also be available on our website, so please stay tuned. Thank you. Have a good afternoon.